We're gaining more insight on the dangers of strep A, as officials report 48 deaths linked to the virus here in Canada between October and December of last year, including 6 children. As we told you on Wednesday, 4,600 cases were reported to the Public Health Agency of Canada last year, marking a 40% increase when compared to numbers from 2019. And hospitalizations during the last 3 months of 2023 were nearly double those during the same time in 2022. Cases of strep A reached an all-time high in December, with 222 infections on record. And for an expert view on the rise of strep A, we're joined now by Dr. Upton Allen with SickKids Hospital. Thank you for speaking with us today.
My pleasure.
Now, Dr. Allen, these numbers may seem startling for some parents. Can you talk to us about why strep throat can be dangerous and some symptoms to look out for?
Well, sometimes strep throat does, in fact, in most cases, result in a very mild illness. But it's not really the strep throat itself. It is the strep bacteria. And most children with strep throat do not have an issue. So it's not really strep throat that we are focused on. We're focused more on the bacteria. And what happens sometimes is that children who have had viral upper respiratory infections, some children may go on to develop secondary bacterial infections, such as this strep organism causing a severe illness. Now, when kids have had a recent illness and they're supposed to be recovering, and certain signs or symptoms develop, then parents ought to be on the alert for those. And I can go through some of those in terms of what parents should look for. So, for example, a child has viral illness, they're supposed to be getting better, but if fever persists for more than 5 days, or they're a very young infant, less than 3 months of age with a fever, or they have weakened immune systems, or the fever is associated with a rash, such as a sandpaper type rash, or indeed any type of rash, or they're having difficulty breathing, catching their breath, or evidence that they're having difficulty oxygenating their bodies. And so pale skin, pale lips, blue lips, these are all things that parents ought to look out for. Sometimes it might be that kid is otherwise reasonably quite well, but they deteriorate quite suddenly, or they're lethargic. You can't wake them up. If any of these occur, then parents should visit their local emergency department as soon as possible.
Now, you spoke a little bit about the bacteria. We heard about those startling numbers. How are people catching strep A, and are there any preventative measures that we should be taking?
Yeah, it's a really important question. What we've seen so far is that it does appear that a number of these cases seem to be following a viral illness. And so perhaps one way to think about preventing these cases of severe invasive group A strep is to focus on preventing the viral illnesses in the first place. And so to begin with hand hygiene measures, or in fact, general hygiene measures, staying home if you're ill, or indeed, if you do have a strep throat and you're being treated with antibiotics, you want to stay home for the first 24 hours. And then we also have seen where cases of severe invasive group A strep have followed influenza. And so influenza vaccine, if you're eligible, that you should be vaccinated. Also, cases might occur after chickenpox. So chickenpox lesions might become infected with the strep bacteria, and that also can be prevented by vaccination.
Now, what are some of the treatment options for this virus if you end up getting sick?
So the most important thing is early recognition that this is not just an ordinary strep infection, and the signs and symptoms that I listed earlier are extremely important. When you visit a doctor, then the physicians are primed, they're looking out for this. to recognize the importance of early treatment of these children, or in fact, adults as well. And there are antibiotics that may be used. But in addition to that, if they do have severe invasive group A strep, they would be admitted to hospitals, and treatment would consist of antibiotics as well as other types of medications.
Now, we know that strep A is associated with the risk of hospitalization. Have you been seeing an increase in cases at SickKids in recent months?
Well, we're still reviewing our numbers, but generally what we've seen is consistent with what is being described by Public Health Ontario across the province. In this regard, there are some areas of the province where there are more cases per 100,000 than others. It's our impression that in December, compared with November of last year, for example, we saw more cases. We're still evaluating the trends in January to see whether or not things will level out.
Okay, well, thank you, Dr. Allen. That's Dr. Upton Allen with SickKids Hospital joining
Pleasure.
us.